Thank you very much, Ashley. And I'd like to invite Vlad Diaconita to please come up. And Vlad is going to be speaking about occupational musculoskeletal pain and injury in Canadian ophthalmologists.
All right, good afternoon. So hopefully you guys have had a chance to take a look at the questions we put up. There's only 3, so if you haven't had a chance to, I'll give you about a couple seconds here if you can log in, give us a good idea of what you guys are thinking about MSK Pain and what you think we should be doing at your local site. So actually, I don't think the text poll works because of the poor reception here, but the internet should. Before I start my talk, I want to thank Dr. Mather. Her and I have been working on this for, I guess, almost about a year because of the IRB takes a little bit longer than you'd like, but a number of other people also involved, especially Lauren Bellin for bringing us in here. I think it's really important to have this discussion as a group. Nothing to disclose. Just want to say we're from London, and if you don't know where London, Ontario is, it's a beautiful place to be, especially in the summer and fall. And our site actually looks pretty good. We did have a new renovation recently, so if you want to visit anytime, we'll be happy to put you on call if you want. So as you know, MSK pain and injury is common in ophthalmology, so both in the clinic and in the operating room. We kind of know that already, and there's been a number of studies published. Dr. Brissett talked about them, but just to highlight 2 of them, Dimitri and Kitzman did 2 separate studies, both are surveys. Essentially, they found about 50% of ophthalmologists reported MSK pain in the last month that they attributed to some sort of work-related activity, with neck, lower back being the 2 most common sites. I was myself involved with Dr. Basir Khan and Mike Richards when I was a medical student at a study in Toronto. Found very similar findings. And so when I approached Dr. Mather, I said, why don't we do this across Canada? She was very excited. So happy to present those results today. So really 3 things we want to talk about. So how common is it in Canada? What are characteristics of physician practice patterns that kind of can be attributed to this MSK problem? And what's the next step? I think that's really important. And that's why George Matos is really good to have him here today. So it was a SurveyMonkey survey everybody here got, so I'm sorry to spam your email. I think we did it a couple times, but people were very, very friendly, answered our questions. We had about a 17% responder rate, which for an online survey, a lengthy one at that, is really good. Close to 90% of the people who started the survey ended the survey, went to completion, which is really good. And the results, really what you want to know, right? So first of all, most of our responders were men. As far as age distribution, pretty even distribution. As you'll see, most of the people, are between 30 and 65. That's the mean of our profession. But what's really important is we actually also asked the question, how many years have you been in practice? And what you'll find is we have a nice distribution, but majority of our responders are early practitioners. And that is important to note. So, first question we asked. In the last 12 months, have you experienced any pain that you could attribute to working in the clinic? And the literature said 50 to 80%, 50-50. That's a significant number of people, right? We wanted to see, well, how does this compare to our colleagues? So optometrists have similar clinics, but they don't have operating time. So we asked them too. Okay, a little bit different. You'll remember from your residency that optometrists are doing a lot of refraction, and if you're a refractive physician, you'll be doing that as well. But I think that actually impacts shoulder pain quite a bit, and our results in the optometry survey will be published later as well, so you can take a look at that if you're interested. What about operating time? So everybody knows the OR can be a place where you get a lot of your MSK pain, and we found that it's going to be close to 50-50 because if you take out all the physicians who don't have a surgical practice, about 40-80% of responders had MSK pain attributed to some work in the OR. So again, very, very, very important to note. So how does this actually compare to what we found in the literature? So looking at the sites of pain, so neck pain was number 1 by far. Close to 50% of responders had some sort of neck pain. Severe, only about 2%, but anywhere from moderate to mild up to 46%. Shoulder pain was next, followed by lower back pain. So again, the sites we know are an issue. Now we're putting some numbers to it in Canada. Same information, different slide. So you'll see neck, lower back, and shoulder are first. Upper back, hand, wrist, and elbow are towards the bottom there. But again, moderate to mild pain accounts for majority of that, but that means people are doing something. They're doing something to combat this pain, or it's impacting them in some way. Pain duration, okay. So anywhere, well, you can have pain for an hour. You can have pain for a month. Those are different. But you'll notice that a significant number of people had pain for months to a few weeks, and that's significant enough for me to think that there's something that we need to do about this. An hour or two, you can kind of, talk about that, but a few months at a time when they're having significant pain is definitely in some way impacting these practitioners. So let's find out in which way it's doing that. So having talked about that, what are the characteristics of these physicians who are afflicted by this MSK pain? So we did a logistical regression analysis, and we took a look at all the data that you guys were very happy to input into our survey. And what we found was a past history of cervical disc disease. Again, this is self-reported by physicians. Had an odds ratio of 2.5, and the same with operating room time, about 1.7. So having previous cervical disc disease or any history of cervical disc disease does predispose people to having MSK pain. What about other factors? So you'll wonder, well, what about age? So we looked at age. Remember this graph? Clinical-associated pain and OR-associated pain seem to have this mid-career peak. So between age 40 to 50, you're seeing this mid-career peak of MSK reported pain. Why is that? Well, maybe practitioners are finally starting to ramp up their practice to larger numbers, or perhaps your habits that they've been harboring for a number of years are finally catching up to them. So that's an interesting thing to look at in the future. How do we deal with the pain? Busy slide. What you need to know is we're doctors, so we like to do very little. So we're going to do NSAIDs and rest and massage, and we're not really going to have a lot of surgery. Previous studies have reported about 7-8%. That's not what we found, but definitely a lot of NSAIDs and rest and massage. And who do we see? Well, if we're getting a lot of massage, we're going to see the massage therapists. So they're number one in our list. But physio, family practice, and personal trainers are close by. We really don't like to see the neurologists and neurosurgeons, and that's probably a good thing, but that does also mean that a lot of our cervical disc disease is maybe not looked after in the appropriate way. So, last but not least, where can we go from here? So, first thing I want to ask is, well, what do we think the problem is? What do you guys think the problem is? So, as you'll know, this is a busy slide, but I'm just going to summarize it. Performing the same task over and over again. So repetitive tasks are the number one thing you guys think are giving us this problem. Working in cramped or awkward positions, again, and working long or erratic hours. Very similar data to what Dr. Brissett just presented. So we're right on point with what the literature has shown so far. Which specific tasks are the issue? Well, again, it's great to go after Dr. Brissett because it's very similar information, so I'm glad that we're finding the same. Slit lamp are number one, surgery with microscope, and then slit lamp lasers. So it's that positioning of the slit lamp and in the OR that's causing us most of the issues. You'll note that intraocular injections are last. That's only because we have few retina specialists who actually completed the survey. So maybe as we get more retina specialists completing the survey, we'll find a different result for something like that. Great. So a little summary, and then we'll present your results from our survey. So again, 50% of clinic pain can be attributed to, 50% of responders had some sort of clinic pain. About 48% of surgical practitioners had some sort of pain. And neck, lower back, and shoulder are the three common sites, so that's what we want to target. There's a mid-career peak in MSK-related pain in ophthalmologists, and that's interesting to think about. Having cervical disc disease is a risk factor, and those are kind of the issues that we're combating. So slit lamp, surgery, microscope, and maybe even the length of surgical case. Couple limitations to our study, and you guys can give that a read, but essentially it's an online survey. And the next steps, this is where George comes in. It's all about analyzing the rest of the data and having a grassroots discussion. Having this discussion here is important, but bringing it back to our sites. That goes back to our results here, so let's see. That's not really, well, that's too bad. It never works when you want to. But anyway,
Okay.
Oh, there we go, perfect. So I don't know if anybody actually completed it, but thanks so much.